Now, a promising lung cancer treatment from Cuba that's drawing attention from U.S. patients. Some Americans are already traveling there to try the drug in the hopes of stopping their cancer from growing. Former President Obama cleared the way for collaboration between both countries on such research, and clinical trials have started. Those trials may take years, but early results have some researchers intrigued by this new form of immunotherapy. Special correspondent Amy Gutman has the story.
Mick Phillips travels from his home near Green Bay, Wisconsin to Cuba once a year. Despite his passion for vintage cars, that's not what draws him. He goes there for Simovax, a Cuban-made drug used to treat cancer that's kept him alive longer than any doctor predicted.
So I have this little lunchbox thing here that's insulated, and in there I carry my medication, and I also carry gel packs.
Phillips is 69 years old and owns an industrial pump factory where he continues to work every day. He was first diagnosed with non-small cell lung cancer 7 years ago. After chemotherapy and radiation treatment, his cancer went into remission, but it returned less than a year later in 2011. He did another round of chemotherapy, then took Simovax, and is now in remission. Fewer than 5% of stage 4 lung cancer patients like Phillips survive for 5 years, but Simovax appears to be improving those odds for some.
I started the Simovax and have been cancer-free ever since.
And how long were you supposed to live once you went into remission?
The prognosis was maybe 6 months to a year.
How many years is that?
That was 6 years ago.
At La Pradera, a hotel-like hospital near Havana, Phillips pays about $5,000 for an annual supply of Simovax. The doctor visit costs only $50. Back in Wisconsin, Phillips says he's lucky that his oncologist, Dr. Timothy Goggins, continues to treat him. American doctors can't prescribe Simovax because the Food and Drug Administration won't approve it until U.S. clinical trials can prove its effectiveness.
How are things going?
Oh, pretty good.
Dr. Goggins monitors Phillips with regular scans.
Compare this to where he is today. No evidence of growth necessarily in that area. In fact, there might even be shrinkage. I would have expected, in this case, further growth definitely within the lungs. I'm surprised Mick's still here. So I do believe that, outside of divine intervention, there's some sort of scientific basis to what he's doing.
Published results of trials done in Cuba show those given Simovax lived on average as little as 3 months and as much as 11 months longer than those not given the drug. Some did even better. Dr. Michael Caligiuri, president of the American Association for Cancer Research, says even with the success in Cuba, there must be further study.
Whenever there's an early evidence of efficacy in a single population, a single institution study, the chance that it will be replicated interinstitutionally is real, but not a given.
This facility outside Havana produces Simovax. It doesn't kill cancer cells. Instead, it engages the patient's immune system to reduce the protein cancer thrives on. What makes this different from other immunotherapies is it uses a patient's own antibodies rather than manufactured ones, which carries fewer side effects and is cheaper. Researchers at Roswell Park Cancer Institute in Buffalo, New York, waited 4 years to get the green light for clinical trials of Simovax that began in January. The Institute's chair of immunology, Dr. Kelvin Lee, was in Havana recently for a conference.
In many cases, the tumors just stop growing. They're there, but they don't get any bigger. The patient has the possibility of going on for a very long time.
Simovax is given by injection and is considered a therapeutic drug for now. But Dr. Lee and his colleagues are applying for funding to test it as a preventive vaccine for high-risk patients.
Because it is safe, inexpensive, easy to administer, you could use it potentially to prevent lung cancer.
The embargo that prevented Cuba's access to American pharmaceuticals led the late President Fidel Castro to invest heavily in developing medicines and vaccines. Former President Obama traveled to Cuba last year. He later announced new policies making it easier for American researchers to apply for FDA approval to trial Cuban drugs in the United States.
I found this 53 Chevy convertible.
Mick Phillips voted for President Trump, but Mr. Trump has vowed to roll back some of Obama's policies when it comes to Cuba relations. Phillips fears what that could mean.
I am concerned that the access to this medication will go away for many, many people.
Dr. Lee says it's all part of a potential change in the way doctors approach cancer treatment.
There is an idea that's developing of converting cancer into a chronic disease. We give you a pill that you take every day and it allows you to live a perfectly normal life.
Outside Cuba and the U.S., there's great interest in Simovax. It's approved in 5 different countries. Worldwide, 5,000 patients have been treated with the drug since 2011, 1,000 of them Cubans. But no one sees Simovax as a magic pill. 20% of vaccinated patients have not lived longer than the average survival of the unvaccinated group. No. Phillips' doctor Tim Goggins says there are many unknowns about the drug.
At some point in time, the immune system will probably not respond to that cancer cell. The cancer cells find a way around it.
Mick Phillips hopes the new American president will allow the progress he credits to Cuban drugs to continue.
The key is that the political relations staying in place. If that relation stays as it should, I believe that we can all benefit from it.
Since taking office, President Trump has not said much more about his approach toward Cuba. It's still unclear what this could mean for future trials of the drug. For the PBS NewsHour, I'm Amy Gutman reporting from Havana.